Hello friends. Many of the psychiatric patients are put on what are called as antipsychotics. Some of the medical students have been after me to make videos on certain medical topics also, so that it can help them to prepare for their examinations, be it theory, be it practicals, be it orals. Diabetes is a complication which can occur as a side effect of treatment of psychiatric patients with certain antipsychotics. Some are notorious to produce an alteration in the diabetic glucose tolerance curve. Which drug is that? Olanzapine, which is an antipsychotic which is being perhaps used in an unduly excessive manner, not by psychiatrists per se, but by certain doctors who do not have, a deep knowledge of the medications in the therapeutic armamentarium of a psychiatrist. These drugs can cause diabetes. Few of my patients who had developed diabetes due to this cause, they landed up with ultimately what's called as diabetic foot syndrome, diabetic foot as we call it. 15 to 20% of diabetics in their lifetime can ultimately develop diabetic foot. Prevention is better than cure, at most in case of diabetes. What cannot be cured must be endured. We have seen patients undergoing amputation because of diabetes. Diabetic foot, diabetic ulcer, diabetic gangrene, unfortunately, are on the rise because of faulty lifestyle, faulty modifications in their eating habits, in their adherence to anti-diabetic regimen. And how do these people die of? Statistics tell us that majority of patients who undergo an amputation, either a below knee one or an above knee one, they die within a period of next 5 years due to myocardial infarction. Patients who have undergone amputation have died due to infarction of the heart within 5 years of their amputation. What is the major cause for diabetic foot ulcer? It is a combination of what? Neuropathic damage, tissue ischemia, excessive pressure loading, and superimposed infection. Infection must be prevented at most in diabetics. When I was studying for my final MBBS, I was attending an OBG posting at Bellary. There was one Dr. Patra Ajaya, he may be no more now. He was an OBG professor. He asked me, what are the complications of diabetes? Like a novice, I told, nephropathy, neuropathy, retinopathy. Pat came the reply from Dr. Patra Ajaya. Mister, forget these pathies. The first thing which you must tell is carbuncle infections. Carbuncle infection. Carbuncle infections. Infections are a major hazardous thing in diabetes. It is so in diabetic foot ulcer also. As a result of neuropathy, there is muscle atrophy. There is limited joint mobility. What does it lead to? Flattening of plantar arches. The concentration of body weight on metatarsal heads and heel. That occurs, my friends. This leads to callus formation. Ultimately, callus formation leads to foot ulcer at these sites. So, vasculopathy plus neuropathy. Vasculopathy plus neuropathy. Remember this deadly combination. Vasculopathy plus neuropathy leads to diabetic foot ulcers. Infection ultimately is responsible for that gangrene, for that ugly amputation also. How do you prevent it? Avoid barefoot walking. Have a proper understanding of diabetes mellitus. Smoking also in such individuals can be an important contributory factor for diabetic peripheral neuropathy, vasculopathy, all leading ultimately to foot ulcers, gangrene, and amputation. The footwear also plays an important role. The vascular surgeons are experts in telling you what sort of shoes a diabetic should wear. Never ever rely on your own insight or judgment to choose your footwear. There are doctors, there are specialists, they are called as vascular surgeons. Approach them, meet them. In Karnataka, we have very eminent vascular surgeons. In Hubli also, we have very famous vascular surgeons. They can give you a proper footwear, they can prevent your diabetic foot ulcer, and they can prevent ultimately amputation also. This video is not only for medical students, not only for medical practitioners, even lay public at large can comprehend the complications of diabetes, because diabetes has become very, very common nowadays. Friends, please watch the video, like it, share it with your friends, with your fellow medicos, with anybody whom you like, so that knowledge gets transferred. That novel you must have read, Die Empty. One should never die with one's knowledge fully embedded in one's brain. So, share your knowledge, share your expertise, share your insight, share your judgment. Thanks a lot. God bless you all.